There are machines that say 15 and there are machines that say 10. This obviously varies by company and the credibility of the company, because it is possible that when you work with the phantom and perform the measurement, you find that the resolution stated in the specification is incorrect. This can happen, so it must be measured. And it must be measured by a physician medical who measures it on the phantom. Now, regarding the Z sensitivity, it is in the range of 0.5 to 10 millimeters. This is the resolution. Now, concerning the Z direction, let's talk about the resolution transaxial, which heavily depends on the largeur du détecteur. Let's take a look at that. If the detector width is relatively small in size, for me personally speaking, then logically, one would expect that there will be an increase in what we refer to as transaxial resolution due to this factor alone. There exists something known within our field of study called an attenuating comb, which moves strategically positioned right at front of said detector, creating thereby what has come widely recognized among professionals as being termed, simply enough, effective detector itself. Now, when discussing effective detectors, essentially referring here specifically towards actual physical dimensions comprising part responsible detecting X-ray photos themselves, it becomes apparent some machines incorporate advanced features designed to enhance overall resolution capabilities through utilization attenuating materials. These effectively reduce perceived sizes. Detectors, while simultaneously improving upon existing transaxial resolutions achieved previously without such enhancements present beforehand. Additionally, worth noting are various factors influencing resolutions, including but certainly not limited scan parameters alongside sampling rates too, latter term essentially describing number projections taken during process, i.e., if currently engaged, taking certain angles. More angles you take or projections you make for the same object, the better image resolution you achieve. However, if sampling or projections you take are few, this situation is called sous-échantillonnage. Sous-échantillonnage means that the number of images you take during the imaging process is insufficient to produce a clear image, leading to artifacts or unclear features in the image. This is very common, especially when working on something like a specific case, and you may find that the resulting image has unclear or insufficient details. This essentially means sometimes it is indeed related to the pitch factor. For example, if the pitch factor is greater than 1, it does not provide enough time for the projections to be completed. There is also another important aspect. Does the focal spot size improve your resolution or reduce it? We know that the smaller the focal spot size, the better the resolution you get. However, there is a problem. If you are working with a small focal spot size, what happens to your tube load or the milliampere that I can use? The tube rating will increase, which means you will increase the tube load, isn't it right? So, the focal spot size improves your resolution, but this may come at the expense of your tube loading. You need to compensate for this by ensuring that if you use a small focal spot size, there is a smaller range of scanned organs, or you should not image large-sized organs while not providing high milliampere settings to avoid increasing your tube loading. Here the difference shows when I'm working with 128 projections or 1024 projections. The difference is evident in resolution. Also, one of the things we should pay attention to is the focal spot size. You can have two focal spot sizes, as we mentioned before, where there are things that have two filaments, a short filament and a long filament. This gives you, for example, the small or the large focal spot size, which can be 0.7 millimeters for the small and 1.2 millimeters for the large. There is something called flying focal spot. What is the topic of the flying focal spot? The topic of the flying focal spot is that it allows you to have the position of the focal spot on the anode as a single point, or it can rotate. It aims to provide an option to change the position of the focal spot very quickly during the projection itself. This increases the effect as if you are taking the projection from two different angles, but for the same projection, so it's like capturing two angles in the same projection, which enhances your resolution. How does this happen? It is said that I will have an electron beam coming from the cathode hitting the anode, and a magnetic field is used to create deflection, meaning it changes the path of the electron beam over a certain distance on the anode. This causes it to deflect, hitting one spot and then hitting another. Here, you can capture in one place and in another location, allowing you to benefit from performing the same projection simultaneously as your projection. First, you change the location of the heating between the electrons and the anode, which helps significantly increase your resolution. At the same time, the node can handle the upper parameters. This is the example or the form we illustrate. If you have a glow and a focal spot, if you perform deflection, you create position 1, and then in the same projection, quickly create position 2. So you have two different angles for the same projection you are providing. At that time, this process increases your resolution. In your process, there is something called detector width, which is a crucial parameter in the analysis of data. For example, the detector width gives you the second half of the data, which is the 1 millimeters of data from the X-ray that comes from this position or the second projection location. This parameter is essential because it determines the resolution and accuracy of the data being analyzed. Understanding the detector width allows you to interpret the data more effectively, ensuring that the measurements are precise and reliable. In many scenarios, such as medical imaging or material analysis, having an accurate detector width can significantly impact the quality of the results. Therefore, it is important to pay close attention to this aspect of the process to achieve optimal outcomes. So, it's like you're dividing the projection or the data that reached your detector or your detector element into two parts. The first point or the first section takes data from the first focal spot, and the second data takes from the second point. It's as if you captured the same location or the same place from different positions or different angles. This means you maximize the number of photons present. You maximize the data that reach the detector. This increases the resolution that you will ultimately achieve. I call this the flying focal spot. This is the form in which changing the position on the anode is very high to determine the number of projects contained in this universe. This is S divided by 2, and this S is as if you divided the projection into two parts or halves, and you divided the data into two parts as if you took the projections, 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 for example, 32. For example, it tells you that this particular device has 8 individual slices, but can give you an image with software reconstruction of 32 distinct ones. It also offers the option of utilizing what is known as a flying focal spot size technique, which is somewhat akin to a specific method used in imaging technology. I don't really know exactly how this advanced technology works. However, it seems to divide each projection taken from these two positions. and create an entirely new one from them both combined together. I don't see this approach as being particularly effective in terms of patient coverage during scan time, but I do see that such a sophisticated technique can significantly impact overall image quality positively. For instance, the aliasing artifact you observe here is actually a direct result stemming from improving upon resolution capabilities within images while simultaneously employing use of said flying focal spot size methodology. The same conceptual idea applies equally well when considering artifacts that might potentially be present, especially if indeed you have access to having such features readily available on your own device. One of the important things improving this topic is there is no disagreement about it, we all agree on it. It also tells you that there is space between one detector and another, meaning that the detector elements themselves have space between them and the adjacent detector. This space reduces something called efficiency. For example, the efficiency of the solid state detector is about 90%, while the geometric efficiency is 80%. Why is it 80%? Because geometric efficiency means that of the X-rays coming from the patient, which are transmitted, only a certain amount are detected. Why is it not more than 80%? Because there is a gap between the detector and the adjacent detector. What is the purpose of this gap? It is not large. It is there to prevent photons at certain angles from being detected by this detector and then hitting the adjacent detector. This gap causes transmitted photons that come in at wide angles to not be detected, which affects the geometric efficiency, causing it to decrease. There is a concept called quarter ray detector offset. For example, if I have the focal spot and here is the detector, the ray for me takes an angle of 0 degrees and I take the projection with that. Then I take another angle of 180 degrees. There is a part that is approximately 1/4 of the detector width. This part will be overlapped between the two angles. The purpose of this overlapping is to improve the resolution. You should ideally position the center of this angle to be the same as the center of the other angle. However, I will create an overlapping area, which is the quarter detector width. This quarter detector width is considered very small, but it creates overlapping in the data, which can enhance your resolution or the resolution of your image. The whole idea is for you to perform overlapping in the data. How to do overlapping in the data? Here, Angel takes 0 degrees as an example. If you were to flip or take another angle at 180 degrees and you stop at the center regarding the angle you took for that object, or at the center of rotation, and then you move to the other side with another angle at 180 degrees. The overlabel they created is about 1/4 of the detector width, which is considered small. So, what will you benefit from this? Simply put, if you have an object you are photographing and you took a certain angle, then you took another angle, that second angle you took is not symmetric or not 100% aligned with the first angle. There is a part in your data that is included. And I want to convey this to you clearly. If you take angle 0 and then another angle 180, if you also take also, It is better if there is an angle in the overall design, structure, and appearance. Or in the projection, it didn't take anything or took part of this. If the two angles are equal, meaning 0 and 180, then for both, they are the same angle, and there is no difference. You are taking from one angle, and the other angle is the same. When you come to capture this part, will it be detected from different angles in a different way? Or will it be the same? For example, you have an object located at the edge of the beam. All right, let's assume this is the same angle, like this. The part that is in the middle here, Dr. Hani, is that part done well at that time? Or is there an issue with the data? Okay, look, just give me the object or item you are photographing, please. Are you okay, sir? Here is yours. Just checking. Is everything all right? Beautiful. Valley. Is that it? Let's assume this is yours that you are photographing. Is that okay? I will take a second angle with the same field and everything. There is a part at the edge of the line. This is the problem area that I want to improve in my value. I have drawn a line for the second angle in this way with the same field and everything. Will this part be seen more clearly perhaps in this particular case? Or if these angles are slightly shifted and brought slightly into the field of coverage with the other angles? Why? What is he doing here, doctor? He did something called quarter shift with something very small, but this small thing will help in the enhancement of the resolution. Why? Because if you have an object that is located on the lateral or on the edges of your field of view and is not visible in a certain angle or projection, when you come to do this overlap, which is a quarter shift that is negligible, you are not talking about a quarter of something small, but at the level of the object, if there is something that is not capturing its attenuation value well, this overlap provides a more accurate value in a better compressed manner, allowing you to do estimation and to estimate the attenuation correctly and to do detection correctly and enhance the resolution. This story is present in some artifacts, like the cone beam artifact. The cone beam artifact indicates that if we agreed in the end that the X-ray was initially a line beam, then a fan beam, and now it is like a cone. This is the shape of the intestine, right? It tells you that for some percentages, it is on the edge. What are you doing for you? It's doing something called this part. What is the result? It's like this part didn't receive enough X-ray, or the transmitted X-rays coming from it are not enough to give you accurate data, to provide you with correct attenuation data. Therefore, what reaches the detector will be low, as if it's an average value. So when you apply this overlapping or quarter shift technique, it improves the situation. If there is a projection that does not see this condition well, there is another organization that observes it and starts calculating the data or the attenuation data normally. Among the things that improve the organization, there is something called a kernel. What is the topic of the kernel? The kernel is a type of filter, a kind of filter that works, for example, when you have an image and you want to make it sharp, you say, I want a bone reconstruction image. What appears in the bone reconstruction? The image is sharp or smooth. Sharp, right. And the soft one is a bit smoother. So when you obtain a sharp image in, for example, the Peters beam, how does that image come about? What does it do? It uses something called this filter. What does this filter do? You have the image in this form. The image consists of squares, each with a specific value. It uses a type of filter, which is, for example, a 3x3 matrix with specific values. These values are determined based on whether you want a filter that smooths or a filter that sharpens. It performs multiplication, multiplying the value of this filter, which is the small matrix called the kernel, with every pixel present in that kernel. The kernel works for correction. Its values can either make the matrix values sharp or indicate sharpness, or they can take high values, effectively enhancing sharpness or increasing the resolution present. It can also perform smoothing or averaging of the existing pixels. This kernel is a reconstruction filter, and it is used to create various filters such as lung window, lung filter, bone filter, brain filter, mediastinum filter, or soft tissue filter. This is available on devices, and the idea is that those who perform high resolution are doing something called, there are two types of signals in the matrix: high frequency signal and low frequency signal. If we talk about this topic, there is something called high pass filter and low pass filter. The low pass filter allows low frequencies to pass through, while the high pass filter allows high frequencies to pass. I always say that high frequencies are responsible for things that have noise, or for things like bone, for example, with soft tissue. Bone has strong sharpness or high density, giving you a high frequency or high noise image or a high contrast frequency. So what happens when you use the kernel and want an image? It works on the incoming signal, smoothing it, for example, the incoming low frequency pixels by averaging them. However, the high frequency signal does not get averaged, so the high frequency appears, which shows high sharpness or high noise, giving you a sharp image. Conversely, if you will use or want or desire the image to be carefully processed, so it works on the existing one to significantly enhance it, and thus making the image appear visually much better than the usual ordinary one. The central main idea is that this essentially refers to a matrix of 3 by 3 dimensions with specific and unique numerical values. These numbers are applied to each pixel based on whether you want to do averaging, smoothing, or sharpening in the image processing. There is a crucial important aspect called pixel size, known as individual pixel size in digital imaging. My image from the CD is a matrix, and the matrix is composed of tiny individual pixels. The pixel size is related to the field of view, FOV, in the matrix. The larger your field of view in imaging, the larger your pixel size, and the lower your resolution ultimately becomes. The larger your matrix is for the same field of view, it means that the number of rows and the number of columns within your image has increased, which means that the pixel size has decreased, resulting in lower resolution. Therefore, pixel size is a significant factor that affects resolution. We previously discussed the next criteria related to sampling frequency. Your sampling frequency must be at least twice or greater than the maximum frequency present in your image. You definitely remember this criterion. There is a relationship between the maximum frequency and pixel size.